Joining us now is the governor of Ohio, Mike DeWine. Thanks very much for being on with us.
Good morning.
I understand your state has several cases of coronavirus, but I always put that up against the actual number of tests. How many tests does Ohio have to test for coronavirus?
Well, what we had yesterday was our first example of community spread. We had this from an individual who was in Stark County. So this is certainly ratcheted up for us. We issued an order yesterday in regard to nursing homes, to limiting the number of people, not only people who can go in, but we wanted to make sure that the temperature is taken of everyone that's going in, whether they're a worker, whether they're a contractor, who's ever going in those nursing homes. We have to have them screened. Today we're going to be issuing an order having to do with the whole issue of mass gatherings. But part of my message to the people of Ohio is, look, it's not just what the government is ordering. That's the minimum. People really have to take this into their own hands, and they need to make decisions. Is this trip necessary? Is this meeting necessary? And when you weigh it against the possibility of getting the virus, most times the answer is going to be no, it's not necessary. It's not worth the risk.
Right, but do you have, how many tests does your state have? Are you still lacking like others?
Well, I think every state does not have an abundance of tests. We got some additional ones yesterday. We are doing this based upon the individuals who are the most dire situation, and that is, what the protocol has been across this country. So we're no different than any other state.
So, Governor, just over here, thanks so much for being with us. You told the people of Ohio what you were trying to do by taking aggressive measures was to stop being our hope that maybe Ohio wouldn't become like Italy, that the United States wouldn't become like Italy. What do you need from the federal government right now, more than anything else, to help you, help the people of your state contain this virus?
Well, I think the actions taken by the president last night certainly made sense. What the federal government can control is our borders. That's probably the most important thing. So those were good words last night from the president. I thought it was, the president had the right tone. It's time for us to put politics aside and to come together. But we're constantly, my director of health, Dr. Amy Acton, who's doing a phenomenal job, as are the health departments around the state of Ohio. We have 113 separate ones. But, our focus is on Ohio. Our focus is on communicating to the people of the state of Ohio, telling them the truth every day, telling them what we know, getting them to change their actions. And, it's tough because people look around and they see nothing has really changed. Everybody is going about their business. So it's hard to get people to understand, look, we have to dramatically change what we're doing. And as all the experts on your show and other shows have said, and the expert advice I'm getting from about 15 doctors who I put together in a working group, and that is, look, our goal is to spread this out. It is to slow it down. We don't want our healthcare system to implode. And that is really the message that I'm carrying to the people of the state of Ohio. But I'm very, very focused on Ohio. This is my job to focus on what's going on right here in Ohio.
Hey, Governor, it's Willie Geist, and one of the things you've been focused on and keeping a close eye on, I know, is the schools there in the state of Ohio. And I ask you this because every state and every municipality, big cities, little towns, are wondering whether or not they ought to keep their schools open. Where are you? I know yesterday you said I'm not ordering to close schools K through 12. Does that change today? Does it change down the road for you? And what is the distinction as we talk about social gatherings between a bunch of people getting together at a concert or a Blue Jackets game or something like that versus a school where there are obviously large groups of young people and teachers all in one place?
Yeah. Again, I consult the experts. I'm not the science expert. I'm not the medical expert, but we pull the best people we can in. And this is the toughest decision, according to the experts, because there are a lot of consequences when you close schools.
Sure.
You may end up, for example, with a lot of kids being taken care of by grandparents. That might be okay if that grandparent is 42, but what if that grandparent's 70 or 65, and where the mortality rate goes up rather dramatically? So that is one big concern. Another concern that's been expressed to me is, about a third of our healthcare workers, have a young child. They have a child in school. So what happens if that child is home and that parent, say it's a single parent, has to stay home, and so you're pulling that individual out of the healthcare system? So I don't have a great answer, but I tell you, we're spending most of today pulling people in, kind of wargaming this in, getting our educators on the phone, getting many of our superintendents and talking this thing through. What I've said is, we should start preparing for that time. We don't know when that's going to be. We know at some point the schools will have to close. But these are, you know, you're trying to weigh the risk of doing it or not doing it. And it's a tough decision, candidly.
Hey, Governor, in terms of the word preparation, you have a primary election coming up Tuesday, the 17th. What are you doing now that you weren't prepared to do, say, a month ago, given the number of people who have been voting in other states? What are you doing?
Well, we had, I think, about 75 polling places that were in nursing homes. So that was the first thing that Secretary LaRose, our Secretary of State who runs the elections, first thing we did is say, we got to get them out of the nursing homes. We can't have that many people going into the nursing homes. We are encouraging people. In Ohio, we have early voting. People can vote today. They can go to their Board of Elections. We're encouraging people to try to figure out a time of day when there aren't that many people there and just go vote. The election is going to be held on Tuesday. We want everybody to go vote. But if you can vote early, you know, if you have an absentee ballot, for example, as long as it's postmarked on Election Day, that ballot is going to count. People can actually go in to the Board of Elections, let's say at 2 o'clock this afternoon or 2:30 this afternoon, when the lines probably aren't going to be very great at all, and go ahead and vote and get it out of the way. So we're trying to spread the voting out and encouraging people to do that so they avoid that personal contact. We keep getting back to, look, avoid situations where you're a lot of close contact with a lot of people. And so whether that's in a restaurant, whether that's in a bar, you know, think about that. Is there a way to avoid that or to lessen that contact?
All right, Governor Mike DeWine with word from the front lines of all this. Thank you very much.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.